So today we're going to be talking about segmentation specifically for MRI scans. So the overview for today is that I'm going to be starting off by talking to you about what exactly is segmentation, so a very simple, brief concept. And then we're going to go into the importance, so the application of it, the limitations that comes with segmentation, and we're going to go into the fundamental concepts. And then finally, finishing off, we're going to talk about the mathematical concepts behind segmentation. So starting off, what is segmentation? In brief terms, when we look at these two photos, segmentation is basically just splitting these different parts on the images into segments of meaningful images, if you can see. So for example, in this one, we segmented these cars into the exact same color. Or for example, we segmented this part, which is classified, which we'll talk about later, as houses and like people. So this is basically just like a brief overview of what exactly segmentation is. So a very familiar application of segmentation is Google's select where all the squares are or where the street signs are. So I'm pretty sure you guys are all familiar with this. This is basically utilizing segmentation but in a different application. So for today, we're going to be focusing on medical imaging. So segmentation is the partitioning of images into meaningful segments. So when we're talking about medical images, we're talking about identifying pixels of organs or tissues or other biologically relevant structures. So applying this to medical imaging, let's look at this image here. So this is the raw image of what we would begin with. Segmentation essentially is splitting this image into multiple different kinds of tissues so that you're able to classify or you're able to identify what each of these parts are. So in this case, you can see they use different colors to be able to segment these things. So for the top part, it would be the cerebral spinal fluid. Second part would be the white matter. And the third row you'd see is the gray matter. So on to the next part, let's talk about the importance of segmentation. So the challenges that comes with segmentation is the fact that first, it's utilized in diagnosis and tissue abnormalities. And during these two situations, the most challenging part about the reason why we use segmentation is the fact that these two processes are time-consuming and they sometimes can be undetectable with the naked eye. So for example, if there's a tumor in diagnosis, we're trying to diagnose tumors. Sometimes doctors can't notice this small spot on the MRI, but we'd be able to notice it through segmentation and through model training. And same thing with tissue abnormalities. And so the third use for segmentation is pre-processing. So a lot of the times, the challenge with pre-processing lies in the fact that there are a lot of unnecessary tissues that can affect tumor diagnosis when we're using classification methods. For example, if there might be 5 different kinds of tissues in the image, we would only need 2 in order to diagnose a tumor. So in these kind of situations, we can use segmentation to be able to get rid of these tissues so that classification can become a lot more clear. And the other part is visualization difficulties, and we'll see an example of this later in the next slide. So for diagnosis and tissue abnormalities, as we can see here, the great thing about segmentation is the fact that when we're looking at this image, we can't really see what's going on. So obviously to a doctor, this is very obvious. But with segmentation, we can even make it more obvious with a mask that is created for us to be able to identify or locate where the tumors are on the image without a doctor having to go through 8 hours and multiple images all at once just to diagnose or just to draw out a tumor like this. And so the benefits of using segmentation in diagnosis of tumors or, for example, looking at tissue abnormalities, detecting those, is the fact that we can increase the speed of diagnosis. We can decrease the physician's workload. And last but not least, we can detect diseases in their early stages. So, using segmentation in a pre-processing step, as we can see in this image right here, you can see that this is very blurred. I think anyone who would look at this would not be able to segment what exactly is white matter, what exactly is the gray matter, or what exactly is the cerebral spinal fluid. However, with segmentation methods, as you can see, the difference between these two is extremely clear. We can see where the white matter is. It's all done for us where the white parts are. We can see that the gray matter is where all the gray parts are, and the darker gray parts will be the cerebral spinal fluid. So with segmentation, we're able to increase or better visualize what image we're looking at. And so with segmentation, we can improve classification or other diagnosis accuracies, and we can improve the visualization of the image that we're looking at. And that would be potentially beneficial for doctors who may be potentially looking at future treatments or looking at what they would be doing for surgical procedures. So the application and impacts, as a summary of what we just talked about, that for diagnosis, it is to increase the speed of the tumor diagnosis. For tissue abnormalities, it's to identify abnormalities that are not detectable with the naked eye, and potentially to even find some early detections early in the stages of whatever disease we're looking at. And for pre-processing, it is to assist other deep learning methods to be able to improve accuracy, for example, as classification, as we talked about. So the application and impacts of segmentation is the fact that segmentation can assist doctors to diagnose and make decisions. So current segmentation algorithm limitations include two different parts. So the very first part that we're going to talk about is the different organs. So with segmentation, a lot of the times we require different segmentation techniques for different kinds of organs. For example, for the brain, it may be different from the thorax because the thorax is more sensitive to motion artifacts, whereas the brain may be sensitive in terms of the motion sensors. And with different organs, it is possible that when we have different modalities, there are different characteristics within that. And so talking about image variation, a lot of times the algorithm cannot segment the parts that we want as well due to multiple reasons, such as regions with missing edges. So because of these differences that the algorithm is not able to detect or learn very quickly, since it's always different, a lot of times these missing edges can mess up the accuracy of the segmentation. In addition, we can also see the absence of texture contrast. So let's say an entire image that was mostly gray, like the image that we saw before. There was barely any contrast within that image. So it's very easy for the algorithm to not detect exactly the difference between the two. It's very different from human eye. And the other two parts is the region of interest. For example, if it's way too small tumors are very hard to detect by algorithms. And for example, background problems for foreground and background, if there's something that is bigger, it would tend to learn those bigger features as opposed to the smaller features. So to summarize, the biggest problem with segmentation is the fact that there's no method that is suitable for all kinds of images, and this includes all kinds of organs and modalities. And there's also, vice versa, no image that is suitable for all methods. So for brain, for example, that we're going to be focusing on, there isn't an image that would be able to be suitable for all different kinds of segmentation methods that exist. So talking about the very first thing that we were talking about with different organs, this is an example of a thorax. So with thorax, the biggest problem lies in the fact that it is very, very sensitive to motion. And this is because, as we know, it's like breathing. So with the sensors, it is very hard for them to detect what exactly they're actually looking at or segment it from an image that was originally looking like this. And for the brain, as we can see, there's a lot of different parts to it that sometimes it may be very hard to detect. For example, for this image, it is very hard for the algorithm to be able to grasp the three different things that we're looking at, as we said before: white matter, gray matter, and cerebral spinal fluid. This is what it should be looking like, but a lot of the times the features that it extracts or detects are all over the place. That makes it very hard for the brain to be able to for the algorithm to be able to segment the brain. So going on to talking about the fundamental concepts of segmentation. So the workflow for this is that we have an input image, an MRI scan, as we talked about, that we're going to be focusing on in this lecture. It goes through a pre-processing process that we're going to be talking about, and then it goes into the segmentation model training process where you're going to be finding the ground truth and the loss function by inputting these, and then training out a model that would be spitting out for inference. And this is where we would put our test data into it to be able to get, and compare it with the ground truth, to be able to get our segmented image as well as our loss function, which we will be going into deeper in this lecture. So for the pre-processing process, these are necessary steps prior to segmentation, and it varies for different organs. So specifically, we have a set of pre-processing methods that we would be using specifically for MRI scans for the brain. So pre-processing for MRI, the very first thing that we would be looking at is the MRI bias field correction. The second thing we'd be looking at is the brain extraction. And the third thing would be optional. It's not necessary for everything, and it's called registration. So usually we use registration when there is different modalities, for example, from CT to MRI scans. So for bias field correction, the main problem with this is the fact that there is a non-standard signal intensities in MRIs. And so with bias field, what it is exactly is that it is low frequency, spatially varying MRI artifact. And what happens is that it causes intensity variation within the same tissue. So we're going to see an example of this later in the next slide. And this is usually caused by spatial inhomogeneity of the magnetic field. So that is one possibility. The second possibility may be the reception coil sensitivity. So there may be variations in sensitivity when the receptors are receiving signals from what it's capturing in the brain. The third thing would be the interaction between the magnetic field and the human body. So these interferences can cause the bias field that we're talking about, that can potentially kind of just mess up the segmentation process. And so bias field is very, very much dependent on the strength of the magnetic field. So a 0.5T MRI scan may not be it may not have as much of an effect as a 1T, for example. So the stronger it is, the more effect you would see, or the more bias field that you will see in the images. So for bias field correction, as I said, we'd be seeing an example. So before correction, this is what we see. And with bias field, what we see is that this is the exact same tissue, but you see this gradation. It goes from light to dark. So this is what we define as the bias field. And so after correction, we would be inputting like an algorithm that would fix this problem. And after correction, what you would see in comparison to the original image is the fact that there's no obvious gradation within that anymore. So it's a lot easier for the computer or for the algorithm to be like, okay, well, this all looks the same, so I'm going to start segmenting things depending on the intensity differences that I see within the nearby pixels. So mathematically speaking, what you would see before and after bias field correction is that before you would see this variation. This is what I was talking about in terms of this gradation of colors that you will see across the same tissue. And so after correction, what it's basically mathematically doing is that it is smoothing out all these variations so that you can see this clear picture where it is less varying within the same tissue. So it's easier for the computer to be able to segment this brain. The second part is brain extraction. So the problem with brain extraction lies in the fact that the skull has similar intensities as the tumors. And so the other part is the fact that there are overlapping intensities with the brain tissue intensity. So for example, there might be other parts, the skull or the non-brain parts might have the same intensities as the brain tissues that we're looking at. So it's very easy for the computer to be like, okay, this non-brain part is the same as this tissue that we're looking at. So they're going to identify both of those or segment both of those as the tissue that it would like to classify as, even though it's not true. So this is why we need to extract the brain from all the other parts that we're looking at whenever we have our MRI scan. And so the method that we achieve this through is by classifying voxels as brain or non-brain to be able to create this binary mask or image with just brain voxels. So for example, with the original image that we saw, there would usually be like a skull around the outside. And so what it would do is that everything that's outside of that gray matter or the cerebral final fluid, everything outside of that would be defined as something that is non-brain, and everything within it would be defined as something that is brain. And this is before the entire segmentation. So we're not looking at the white matter or the gray matter yet. The solution to this is by using the brain extraction tool, and what happens is that it finds the center of gravity of the brain so that it can inflate the sphere until the brain boundary is found. So this is how the brain extraction tool works, and a lot of people use this for brain extraction. So a lot of the times we identify the non-brain tissues that you would commonly see in brain MRI scans is fat, skull, or the neck, depending on which orientation or which angle you take the brain MRI scan from. So an example or a to visualize brain extraction, before extraction we can see here, it is basically just, you can see the entire face, the nose, the neck, the skull, everything. And so what happens, as I said before, is that it creates this binary mask of non-brain to brain tissue. So this is where they would define the brain as, and everything outside of it would be defined as a non-brain. So this is the binary mask it creates, and after extraction it identifies, it puts this mask on top of the original image and creates this image at the end to show or identify where the actual brain or where the algorithm is going to be looking at. So for the third part that we talked about, registration. So this process is very optional, and we're going to go in deeper depth into this concept in a different lecture. But just a brief overview today. The problem with registration is that sometimes it's very difficult to compare images that are taken, for example, at different times or from different viewpoints, or even with different sensors, so like different modalities, potentially MR to CT or PT or SPECT scans. And so the method of this is basically spatially aligning two or more images by finding a transformation between these images so that they can become overlapping and easier for us to identify the difference between these images. And the solution to registration is usually either co-registration, which is basically used when there is the same subject or different modalities, or realignment, which is basically for motion correction or normalization. So going on to model training, it is basically to learn to segment these images. So the workflow for this is that we would have the pre-processed image that we talked about that has gone through the pre-processing steps that we talked about. And what would happen is that this is for every single slice or every single image that would come in. It would create this mask and be compared to the ground truth. And with the loss function, it would find a loss value and use that value as the new origin for that loss function. And this would keep, and what would happen is that the loss value would come out. And so what usually happens is that this process keeps reiterating. So it's an iterative process that keeps going on until the loss function is minimized. And that's when the model finishes training. So the segmentation methods include actually 4 that is commonly seen. First one is manual segmentation. The second one is intensity-based method. Third is atlas-based method. The fourth one is surface-based method. And a lot of times we have a fifth, which is basically the hybrid or hybrids of some of these, which will be going on later in the 4th section of this lecture. So the loss function is basically gradient descent in model training. So what we can see here, I'm pretty sure you guys all have a little bit of understanding, and if you don't, this would just be a very brief basic concept of what gradient descent is. So what you can see in terms of what we were talking about before is that what happens is that this is like the very first iterative step, we can see that. And so what happens is that the image comes in, it creates a mask that we were talking about, and then that mask comes out, and this is defined as the origin. And so what happens is that this function just keeps decreasing depending on the parameter. So the parameters keep changing until it keeps going down until the function is minimized. So as we can see, this mask creates this new point here, and it keeps going down until we reach that minimum point. So this is where the aim of this entire model training is, and that's where it also finishes. And so the trained model, basically what happens is that after everything comes out, this is just like a simple regression equation. Doesn't mean that it definitely follows this. But what happens is that we have this trained model that we would be able to use for inference later on, where we can just have this testing data, put it in using our trained model, and then spit out results or predicted tumors that we would see later on. So for the inference section, which is basically using the trained model to be able to segment the testing data that we currently have. So for this process, what we have is the input is the testing data set. So using the trained model that we have from before, we would have the ground truth that would also come in at the same time. And what happens is that it calculates the model accuracy by comparing between the ground truth and the testing data set depending on the model, the trained model that we originally had. And using this method, what happens is that we would get the loss value. So I would be talking about the loss function that we'd be using in this case for accuracy, as well as the segmented image. And so the parameters are basically minimized minimize loss with gradient descent. So that's the entire process or the entire aim of training the model and getting the inference. So inference in an example. So going back to everything that we talked about, this we can see as the testing data set, for example. So putting that into our trained model, what we'd end up having is that we would actually end up having our segmented tumor. So where the algorithm or where the model decided to predict the tumors. And what happens is that it compares it to the original label. So the ground truths, for example, the ones that the doctors labeled for us. And as you can see, these two different colors, this is where we see the differences. And the difference or the accuracy of the model is calculated by the dice loss. So this value, as we'll go into deeper later in our mathematical concept, allows us to determine how accurate our model was. And in addition to that dice loss, as I said, we would get our segmented tumor. So on to the mathematical concepts. The first part of this is analyzing the image. So how exactly do computers read the images that we're looking at? So image analysis consists of three things that I think is very important to remember. The very first thing is it uses spatial context or neighborhood information in order to determine or to read the image that we're looking at. The second part to it is the intensity dependent on the gray intensity of its neighbors. So what this means is that it is very dependent, the intensity of the voxel or the pixel that we're looking at is very dependent on the intensities of the neighboring voxels or the pixels that the image would be looking at. And the third part is reading images by voxels or the coordinate system. So for example, the difference between a 2D and 3D image would be the entire image as you see right now. This would be the 3D part to it. And so what would end up happening is that we would see these different kinds of boxes, and this is how the computer would be determining or reading this image. And it would be based on the IJK coordinate system, so the 3D system. Whereas for 2D, which is an MRI slice, for example, if we slice this 3D image into multiple infinitely small slices across the I and J plane, what we would ultimately get is this part that you would be seeing right here. You see that flat surface? That is exactly what we'd be getting if we slice this 3D image or the 3D image of the brain into 2D slices. And it would be using the I and J coordinate systems in order to identify or in order to read the image. So as I explained before, the difference between 2D and 3D images is that 2D, we would call them pixels. That's something to remember. And the pixels, each pixel is determined by their I and J values. And the difference between that and the 3D lies in the fact that for 3D, what they have is voxels. We call these voxels, and it is determined by the I and the J and the K positioning in order to determine where they are in this space. So for image features, there are things that we need to consider or things that we need to be reminded of because the way that we interpret images is very different from the computer. So image features come into play when we're segmenting images and is very, very important. Very first thing to remember is the fact that it is numerical measurements. So it is quantitative visual appearance and shape descriptors. So these are things that the computer would be reading in order to determine what features it is looking at or in order to learn their features. The second part to it is to discriminate between the structures of interest and their background. This is the entire point of recognizing the features. And the outcome of the image of the image segmentation is actually very, very much dependent on the appropriate feature selection and accurate feature extraction. And this is usually through a statistical approach. So what this means by is the fact that if we can't, or if the model can't learn or determine the features that we're looking at accurately or very precisely, then what ends up happening is that we have this segmented image that isn't actually the way that we wanted to segment it in the first place, because it wasn't able to learn the features. So it wasn't able to learn what a tumor looks like. So instead of segmenting the tumor when we were supposed to, it segmented a part of the brain that wasn't even the tumor. So that is the result of a model that isn't able to pick up on the important features or learn it very accurately, and to be able to extract it accurately as well. That's the important point. You have to learn and extract accurately, both parts to it. And so one thing that I want you guys to consider is, what is an example of a structure of interest? So you guys can pause the video right here, and I'll give you guys like probably 5 to 10 seconds to come up with anything, dependent on what we talked about before. So as we said, there are 2 parts to this. The first part is preprocessing, which is the classification method, and the second part is the diagnosis and detection. So for classification, a lot of times, as we explained before, there are lots of things that we would like to determine. So when we're classifying just between brain tissues, it would be white and gray matter, or like cerebral spinal fluid. And then if we're trying to extract the brain, for example, sometimes we would want to identify the skull. So that's a feature that we would want our algorithm to learn. And for diagnosis and detection, as I was speaking before, a lot of times you would want your model to be able to learn a feature, a tissue abnormality, for example, if there's an indent, or for example, if there is a very bright voxel or pixel that could potentially represent the tumor. These are the things that you would wish, or the structure of interest that you would wish the model can pick up on. And so image features examples. So an example of this is when the model is learning features, what it ends up doing is that it looks at that middle point, or for example, let's just set this point as the point that we're looking at. And if we're focusing on this, what the model ends up doing in order to learn these different kinds of features, or to identify what this image is that it compares it to its neighboring pixels. And it's the exact same thing with 3D spatial models, but the only difference is that it compares from all different places. So it's not just right, left, forward, and backwards anymore. It's also on top of you and below you, and that's only because it's in 3D. So these two are in the same thing. You can think of 2D and 3D in the same way, except the fact that there's just an additional dimension. So it's not any more complicated than you think it is. And so going on to the loss function. So the loss function that we usually use is gradient descent. So as I explained before, if you guys kind of remember, let's re-jog our memories a little bit, but we're going to go a little bit deeper into the mathematical concept, or the intuition behind this. So with model training specifically, we use gradient descent as our loss function to calculate our loss. So what we end up wanting to do is we want to minimize that point, as I explained before. So the aim of the entire model training is to be able to hit this point. And so a lot of times it uses this equation, B is equal to A minus gamma, and then delta F of A. And so what we see in this case is the fact that it uses this equation that keeps updating its parameters in order to reach this minimized point. And so A is the current position. So in our case, what we would be changing A every single time is, for example, when the mask goes in, and we said that that would be defined as a new origin. That's what A is, and it'd keep updating until we reach that minimum point. And so if you can think about it, A would technically keep on decreasing, right? Because you're at a point that's constantly decreasing. And so with F of A, it is basically the direction of the steepest descent. So if we were technically at this point, this value would be directing towards this point, because we know that that red point is the steepest part. And so with gradient descent, what it is basically an optimization algorithm, and it is based on a convex function, and it tweaks its parameters iteratively to minimize the cost function so that we can reach its minimum. So hopefully you guys have a better sense of what gradient descent is after kind of rejogging your memories. So going into a deeper mathematical concept behind this. So what exactly is the intuition behind gradient descent? So as we saw before in the previous equation, what gamma was that I did not explain or mention is that it is the learning rate. So what this means by is, let's compare it graphically actually. Starting off, if we have a very big gamma, so a very big learning rate, what ends up happening is that it would jump around constantly to the different sides of the convex function until it reaches that minimum point. And yes, sometimes it would reach that minimum point, sometimes it wouldn't. But obviously this isn't what the aim is. So this is what happens if your learning rate is way too big. And so this is a parameter that the equation keeps changing with each iteration in order to reach that minimum point. So for example, if we had a smaller learning rate, what would end up happening is something that is more ideal or something that we want more. And what happens is that you can see that it goes down step by step until it reaches that minimum point. And you can see with each step, this learning rate is probably going to decrease more and more. So it's going to become smaller and smaller when it reaches that very minimum point so that it doesn't suddenly jump to the other side of that convex function. And so seeing it iteratively, what we see is that this is the goal that we would like to achieve. So this is the optimal goal that we would like to achieve. But with a high learning rate, as we saw there, what ends up happening is that you see this really steep slope at the beginning and then it just flattens out. But it's not a very smooth flattening out. It is something that kind of goes up and down, because what you're seeing here with that kind of bump is in this place where it's going across from one place to another, and it's going to be jumping around towards that minimum point. Because the learning rate is so big, it keeps jumping around and it can't find that minimum point. So with a low learning rate, what we see is that it is kind of not as steep at the beginning. So what you end up happening is that you would have lots of iterations, which is something that we also want to try to avoid. So the best thing is to have a good learning rate that smooths out towards the end. So one thing that you should always keep in mind of is the fact that the cost function should always decrease after every single iteration. This is how you know that it is working. And ultimately, you're going to see this point where it ends up at the very bottom. So it's either going to increase or it's going to stay the same. So when you know it increases, that's when you know that you finished training your model. Or if it's at the same point, that's also when you know that you finished training your model. So talking about the model accuracy. So the loss function for the model accuracy is usually used with the dice coefficient. So in other words, what you would usually hear is the dice score. So what this actually does is that it determines how closely the predicted segmented tumors are to the ground truth. So how close the predictions are to the original tumors, or the original labeled tumors by the doctors. And so what we can see here is two equations, and these two are actually very, very similar. The concepts are very similar, so what I'm going to try and do is to focus on the IOU, which is basically the area of overlap divided by the area of union. So for the dice score, what I want you guys to remember is that TP is equal to the true positives, and FP is equal to the false positives, and FN is equal to the false negatives. So going deeper into this intuitively, what exactly is a dice score? So comparing that idea, or using the idea or the concept of IOU, we can actually explain dice score. If you can see here, as I explained before, it is the area of overlap divided by the area of union, right? So what we can see here is, let's imagine that these two different colors, or these two different lines, are the predicted and the ground truths. So let's determine the red one as the ground truth and the green one as the predicted tumor. So what you can see is that this is very poor prediction. So what we would get out of this is the fact that it would be a very low dice score. And as you can see, this is because the area of overlap is less in this case. And so because the area of overlap is less, divided by the entire area, you can see that the dice score is going to be definitely lower because there's less overlap between the two. A better example would be where there is more overlap. You can see comparing these two. There's more overlap between the predicted and the ground truth. So obviously the dice score for this one's going to be higher. And ideally what we would want to see is something close to this, where the predicted tumor and the ground truths are ultimately almost similar in terms of overlap so that we can achieve the best prediction for the tumors that we're looking at. So going back and talking about this again, let's ask you a question. Do higher scores represent better or worse model accuracy? So I want you guys to kind of just spit out your answers right now. And I am going to tell you the answer right now. So it is better, yes. And the reason for that is because obviously you would want more of an overlap. So the more overlap you get, the higher your dice score. That's the entire concept of dice scores. More overlap, better dice score, better accuracy. So going on to segmentation methods. So segmentation methods are, what we're going to be talking about is the different segmentation methods used for brain MRI images. So going on to the segmentation methods. So for our purposes today, this is going to actually be very brief. But what I'm going to be talking about is different segmentation methods used specifically for MRI images, specifically for the brain. So as I explained before, these are the 4 different types of methods that we usually see, plus the hybrid. But for the sake of our lecture today, we're actually only going to be focusing on manual segmentation and intensity-based methods. So for manual segmentation, what exactly is it? You can think of this as the most time-consuming method ever. It is, you have a manual operator, which is usually like a doctor, a pathologist, oncologist, anyone who knows how to read MRI images and are able to, for example, label the tumors or label whatever you're looking at. And we would consider this the most accurate, obviously, because you have a human doing it instead of a computer. And this is also based on prior experience. So the way that we analyze the image is going to be different from the computer. And it is basically very, very hard to misclassify, which is why manual manual segmentation is considered as the best method. But you can think of this as very, very time consuming. You have a doctor who would potentially be looking at 152 times 152 images, slice by slice, going through each and one of them by himself, just so that he could extract the contours of the targeted structures that we're looking at. And this is going to be for each patient. So imagine that. The challenges of this is the fact that the image quality may affect the manual operator. So if the image quality is terrible, if it's blurred, if there's a lot of noise, then the doctors won't be able to segment the structures that we're actually looking at. Or, for example, there's a lot of image artifacts that may also affect a doctor's ability to be able to determine or to be able to detect what we're trying to look for. And the other part, as I explained before, is that it is very, very time consuming. So intensity-based segmentation is the second thing that we were talking about. With this, a lot of the times we use it only on cerebral spinal fluid, white matter, and gray matter. So when we're trying to segment these 3 parts, we usually use intensity-based segmentation. And the most common method is the use of intensity histogram, which we'll see later, of all the voxels and fitting a Gaussian function to the resulting distribution. So what we end up doing, the process of it, is that we assign probability of a given intensity to a type of tissue. And this is how it segments, for example, the white matter or the gray matter and the cerebral spinal fluid. This is how it determines the differences. But the one problem with this is the fact that it can't go into detail. So any structure and intensity overlap that we may see, that's when the segmentation may not be as accurate as we would wish. And so talking a bit deeper into the mathematical concept of intensity-based segmentation, as we can see here, what it ends up doing is you would split it up into, you can think of it as like a binary method where for one above a certain threshold, you would consider this area as white matter, for example. And anything else would be considered as like something else that you don't want to look for. And this is only in the case for if we're only looking at white matter or if we're only trying to segment white matter. Another case, and this is that one example that we were talking about, another case is that we could potentially have 2 kinds of thresholds. So in this case, we would be able to segment 3 different things. So for example, this would be white matter, gray matter, and cerebral spinal fluid. In this case, you can have multiple or as many thresholds as you want depending on what you're trying to segment or what you're looking for. And so in the case of, for example, trying to detect a tumor or trying to diagnose a type of cancer that may not consider all tissues but only 3, then maybe we would define anything that is not within a range to be useless to us. And that's when the multi kind of thresholds come in. So the great thing about intensity-based is the fact that it is fast and computationally efficient. But it is very, very sensitive to noise, as we talked about before, and it is very sensitive to intensity and homogeneities, because it is very much based on that. So if there's any sort of noise or intensity problem, so there's no contrast, this is when this method is going to fail. And so just to summarize everything that we talked about today, the workflow starts off with an input image, the MR image. Then we go in and we see that pre-processing part, which is like the end for the bias field correction and the skull removal, the brain extraction. And then that goes into that model training that we're talking about. So the gradient descent part, where we find that optimal loss or the optimal parameters that allows us to be able to minimize our loss function. And then through that, we come out, we put it in, we give our test data into this and compare it to our ground truths to be able to find our segmented image and to be able to determine the accuracy of our algorithm or of our model. Thank you.